ABC 15 going one-on-one with Arizona National Guard State Surgeon Colonel Dr. Tom Leeper, who's helping to lead the effort on the Navajo Nation, assessing facilities, coordinating supplies and staffing for our state's hardest hit community. ABC 15's Cameron Polam explains how these efforts are so crucial to saving so many lives.
It's really hard to prepare for everything that's going to be required for a national and worldwide pandemic.
One that's hit the state's Native American communities hard. The Navajo Nation now tallying 838 positive cases, more than 20% of all cases in Arizona. Colonel Tom Leeper, the state surgeon, is leading the charge there.
So a lot of times it's you don't know what you don't know, and you're waiting for whatever issue pops up that needs to be bridged.
Lately, his days have been filled with medical facility assessments throughout the reservation, hard looks at hospital infrastructure capabilities, equipment, safety procedures, and staffing.
In situations like this, especially with COVID, the absenteeism rate is excessive because of staff illnesses and then just fear of not having enough protective equipment.
Shipments of PPE have been delivered, but it remains in short supply. He says staffing issues recently impacted a hospital in Tuba City, prompting him to request federal resources to fill the gap.
The DMAT team up at Tuba City, they had doctors that were working beside the doctors, they had nurses that were working beside the nurses, paramedics, respiratory therapists, just boots on the ground that are caring for patients.
Along with the disaster medical assistance team, he says 87 specialized civilian medical personnel with the Urban Augmentation Medical Task Force have also been requested to help staff facilities as well as recently constructed recovery areas.
So if you had patients that were close to being discharged and they need the hospital bed, they could go to this alternate care site.
Sites that have not been needed at this point. These recovery areas set up in Chinle are not to be confused with field hospitals. He says staffing current medical facilities with teams like the one in Tuba City is the priority. The biggest problem is those teams are now in demand all over the country.
The small hospitals, if they have somebody that's critical, like intubated, on a ventilator, they have to be shipped out. They can't be managed there long term.
In the short term, it hasn't overwhelmed the facilities taking on those patients, and Colonel Leeper hopes with the headway they're making, it never will.
It's really all hands on deck, and things are turning around.
I'm Cameron Polam, ABC 15 Arizona.